Hello students, we will discuss a post-operative status and identify these things and we will have idea because maybe asked as a MCQ or somewhere they will ask oxy. So what this situation is, look at that, there is an area here, look at that, there is an area here. So must be a major surgery, something they have done. So what is this? It is operated case of oral malignancy with the reconstruction. So what reconstruction is done? So you have to know what reconstruction. It may be photo may be asked in the MCQ NEET exam. So you should know what is what. What are the different? These are the flaps actually. Flaps. So what are the different types of flaps? Random pattern flap, where subdermal plexus will give the blood supply. Axial pattern is one main blood vessel gives the blood supply. Axial, these are the two different classifications, very important. Viva, MCQ, they will ask this one. And other types, of course, based on which component I have taken. Cutaneous, like forehead flap is cutaneous, delta pectoral is a cutaneous, and muscle flap, only gracilis muscle, other muscle flap can be taken. Myocutaneous flap, pectoralis major myocutaneous flap, come here, rotate to the oral cavity, that is myocutaneous flap. Osteomyocutaneous, radial forearm, osteomyocutaneous flap, or TB or other areas, mainly radial or other areas also you can, fibula you can take, not tibia, fibula or myocutaneous flap you can take. So all these are the examples of different types of flaps. Other than free flaps also, because a microsurgery, plastic surgeons or surgery do this flap, become very, very popular, and most places becomes the free flaps become the standard practice as such. And so here, this is forehead flap, remember, from the superficial temporal artery anterior division branch. So that is forehead flap. You can see that here, pectoralis major myocutaneous flap, that is from the chest wall, that with the pectoralis major muscle and skin it is being taken as a thoracoepimal artery, as a pedicle as such. So rotated upward like this, for especially these flaps, sometimes delta pectoral cutaneous flaps also taken as a second perforator, intercostal vessel as a perforator, and all these things are commonly used flaps for the oral malignancies during reconstruction. Of course, current standard already told free flaps. So remember reconstruction ladder. You can go through my book. Term flap is derived from flappe, Dutch word. This is the meaning, which contains a blood supply. You can rotate it, and with the pedicle, that is the word meaning, flappe. That is how exactly it is derived. And so answer this main MCQ. Subdermal plexus forms the vascular basis for random pattern flap, axial pattern flap, free flap, faciomyocutaneous flap. So find out the answer, put it in the comment box. Tomorrow or next lecture, we will discuss about the answer and give the explanation for that. So go through my clinical methods in surgery, manual of surgery, operative surgery, tissue approximation, and detailed video lectures through JP for all topics, whichever as per CBME, UG and PG. So students, I hope you understood a basic about flap very well. Thank you very much.